Hello students, welcome to this session. In this session, we will talk about different diagnostic modalities in pathology, and specifically we will be talking about the applications of cytology. Okay? Cytology is a very important type of diagnostic modality in which we use the needle, the slides and certain stains to make a early and cheap diagnosis. Okay? So, in this session you will also be coming across some questions which I will be going through during the discussion. So, let us see what are the learning objectives for this session. First, we will know what is cytology, then the different methods of sampling or how the samples are obtained for cytology, who obtains this sample, different types of sample, what are the different sites from which these samples can be taken, and what are the different type of samples. Utility of each method, like there is FNAC, there is pap smear, there is fluid cytology. So, what is the utility of each of these type of method? We will emphasize on FNAC and cervical smear, then we will talk little bit towards the cytological features of malignancy and infections with some nice good clinical images as well as pathological images. Okay? So, let us start the session. Now, I have told there are different diagnostic modalities in pathology. The first one is histopathology. The name itself is enough. Histo means tissue and study of tissue is called as histopathology. And what do we get in histopathology? We may get a biopsy specimen or we may get a resection specimen. Biopsy means small bit of tissue, okay? Small bit like skin, small bit. You can get a liver biopsy, you can get a GI biopsy. So, these are small bits, they are called as small biopsy, or you can get resection specimens like you can get mastectomy, which is the total removal of breast tissue, then you can have colectomy where removal of colon because of certain tumor. So, that is about small bit and large bit resection which we study in histopathology. Then coming to cytopathology. Okay? Cyto means cells and study of these cells through FNAC. FNAC is fine needle aspiration cytology. Okay? Aspiration cytology. Now, we put the needle, take out little material from a swelling and make a smear, then stain it to say what is the abnormality. And exfoliative is shedding of cells like body fluids and cervical smears. Okay? So, the third modality is hematopathology and it is study of blood related disorders. Okay? Like you can come across anemia, the types of anemia, coagulation disorders and the malignancy of hematology, that is leukemia or lymphoma. The fourth subtype is immunopathology where we study about immunological disorders like connective tissue disorders. For example, you have systemic lupus erythematosus and rheumatoid arthritis as well as transplant related disorders. So, these are the different modalities: histo, cyto, hemat and immuno. These are the four modalities of diagnosis in pathology. Now, the first modality, that is cytology, which we will be talking in detail in this session and its clinical applications. Okay? So, cytology is study of cells and alteration of cells or cell groups that we see in the smear. First time cytology was performed by Dr. George Papanicolaou around 1920 when he made some smears from vaginal smear, or you can say some vaginal material, and then he saw some dysplastic cells or abnormal cells in vaginal fluid cytology. That was the origin of cytology around 1920. And then he developed the pap stain or pap smear around 1942. That pap stain came into existence, which we still practice. Now, There are two types of collecting material in cytology. I will be coming to the detail, but in the introduction it can be exfoliative cytology where the cells are simply shed, or it can be interventional cytology where we apply certain instruments as well as equipments to take out the cells. That is called as interventional cytology where we intervene, but here it is passive shedding. Okay. If you talk about cervical smear or body fluid cytology, that is under exfoliative cytology, whereas when we talk about bone marrow aspiration, we talk about fine needle aspiration. These things are a type of interventional cytology. Okay. Cytology was practiced around 1942 in the West. It became popular around 1960, but in India FNAC came around 1990 when it started its roots in India. Okay. Now cytology preparation can be smear where we simply make a smear, or it can be a imprint. Imprint is just like touching a tissue in a slide and then staining and seeing, that is called as imprint, and then there is something called as squash smear. I will be talking in detail about that. FNAC has certain advantages, like it is a very fast method, it is a cheap method and can help avoid a biopsy. When I go through this session, you will understand how it is faster, cheaper and can help avoid biopsy. Now, the different sampling techniques that are available in diagnostic cytology. The first is exfoliative cytology. Exfoliative means the cells are shed. Our every tissue in our body, there is a renewal process. So, when there is renewal, the old cells will shed, or when the old cells shed, there is renewal. So, that is called as exfoliation, and when we study these exfoliated cells, that is called as exfoliative cytology, and it is the spontaneous shedding of cells. The second type is abrasive cytology, where we like take a brush or we take a spatula, we take a slide and we scrape the surface and make a smear. So, that is scraping and brushing. Okay. Suppose there is a ulcer in the tongue, I can scrape it or brush it and make a smear. Third is aspiration cytology, or it is a type of interventional cytology. Suppose there is a swelling of lymph node, okay, or there is a lymphadenopathy and we do not know what is the diagnosis. We will just put in a FNAC or we will just put in a needle, take out some material, make a cytosmear, stain it and say that it is infection, neoplasm, metastasis, what is the pathology in that node. So, that is FNAC. The fourth and last is intraoperative cytology. Intraoperative means during surgery. Okay. So, during surgery the surgeon may need the help of pathologist to decide the lesion that they are dealing with is infective or it is inflammatory or it is neoplastic. If neoplastic, it is benign or malignant. So, these things will help the surgeon during operation to decide the exact type of treatment that he wants to do for a specific patient. Okay? Now, to help you understand better, let us start with a clinical scenario. So, here comes a 55-year-old female who presented with the gynae department with a history of abdominal distension since 4 months. So, there is abdominal distension. She has tense ascites and these ascites is causing the abdominal distension. She also has a huge abdominopelvic mass. She has a mass. And she is also in case of renal failure on dialysis. This is the total clinical history. Now, we come to the first question, that is what could be the clinicopathological condition that is causing this, and how do you come to the evaluation of such a lesion or such a patient. That is the second question. But first thing is you have to answer the first question appropriately. What is the clinicopathological condition? I hope most of you have got the answer, but for others I will just discuss it in detail. So, an elderly female who has ascites, abdominal distension, pelvic mass and renal failure. Now, let us start like this. Ascites is there. Now, ascites can be because of malignancy, okay, or it can be because of renal failure. In this patient, both are there because patient has a pelvic mass. So, a malignancy is also possible, patient is a known case of renal failure, so ascites is also possible. Now, how does the gynecologist or the treating physician know that the patient what abnormality is there and how to confirm? So, here if you ask me, then both possibilities are there, but with a tense ascites in a 55-year-old female, I would favor a diagnosis of malignancy. I may not be 100% sure, I will favor malignancy or the clinician will favor malignancy, and then they will do a ascitic fluid tapping, okay. They will take out the ascitic fluid and send it for cytology, and in cytology it will be decided whether it is a benign effusion because of renal failure or it is a malignant effusion because of the pelvic tumor or ovarian malignancy, okay. So, that is how you have to approach such a case. Now, let us talk little bit about exfoliative cytology and the different samples that we get in exfoliative cytology, okay. The first sample is CSF or cerebrospinal fluid. Now, let us see what is the utility. Now, CNS we know can be involved with infections or it can be involved with malignancies. Now, malignancies can again be primary from the tumor from the CNS, or it can be secondary like metastasis, okay. So, it can be primary or secondary, and infections can again be bacterial, fungal or viral.